Hello, my name is Neat Physio and I'm a physio who specialises in cancer. And this video is for breast cancer patients who are recent after surgery. So we're talking around about straight after surgery, so ground zero, to around about 3 weeks after surgery. Now, it's important to say before we start that everyone has their own surgery, their own recovery, their own post-op kind of symptoms or side effects. So it is important to just check with your nurse or your doctor to make sure that these exercises are suitable to you. In most cases they are, but it is worth checking just so we're not going to cause any pain or any post-op issues. After any surgery, it's really important to get things moving because what we don't want to do is lose muscle. We don't want to cause any stiffness to the joint because these two things can contribute to long-term shoulder pain, restriction, or post-treatment side effects or symptoms. So really these exercises are just to wake the body up. Now, these exercises at the moment, after an acute surgery, are best done led on our back, hence why I'm sat on a mat. But it doesn't mean you need to get on and off the floor because I understand you might be in pain or discomfort. So I would highly encourage you to go find a bed or a sofa and use that instead. Some people do find lying on their back uncomfortable. If that is the case, just put yourself at a slight angle, maybe about 45 degrees, using pillows on your bed or your sofa so that you're relaxed, but you're not fully flat. The reason being in a slight reclined position is better is basically it's causing your muscles to fully relax because gravity is not involved and we're not actively trying to pull against gravity. So it's going to take the chest muscles a little bit out of the equation so that our shoulders don't start to drift forwards because that's something we see a lot after this type of surgery. This video is going to be split into section 1 and section 2. Section 1 is for individuals who've got a drain in place. These exercises are simpler, and this is because we don't want to do anything to irritate the drain site. Once the drain is out, you can then work on the other exercises, but it's just to be safe. Really, we're going to focus on activating the muscles rather than any real movement. Whereas section 2, the exercises might look a bit more advanced. That's because we can start to push into a little bit of range. However, what I will say is any of these exercises, whilst you're acutely healing, we don't want to cause pain. So everything should be comfortable. The final thing I will say here is this video is part of a series as we go through weeks of rehabilitation. So follow along to the subsequent videos with the relevant week that's applicable to you. The key thing with breast cancer rehab is we want to improve your shoulder mobility, and that is the ability for you to get nice, good range. Your stability, and that is your muscles working together. So the muscles to the front and back of the shoulder stabilizing together to protect the joint. And then finally, strength, which is load tolerance. And this is important for getting things out of the cupboard, carrying your shopping. And we need to work through all 3 stages because if we miss an element, often at some point, an individual may get pain, discomfort, or stiffness. So follow along, but as always, never push into pain and check with your nurses if you're unsure. Section 1, the first exercise is really simple. We're activating the muscles. So all we're doing here is trying to draw our shoulder blades back towards the mat. So we're trying to imagine there's a pencil case in between your shoulder blades, draw them back, squeeze, and back in. Draw them back, squeeze, and back in. You may feel that the side you've had surgery either doesn't really move or you don't have true awareness of what that sensation is. That's perfectly normal. Doing this, we're waking up the muscles to the back of our shoulder. We're also gently mobilizing our shoulder blade, and we're trying to keep those nerves that may have been damaged from the surgery as activated or stimulated as possible to try and minimize the level of nerve damage. The second exercise is just to get something to squeeze. So it could be a ball of socks, it could be a towel, elbow just in a nice relaxed position, and you're just going to gently squeeze with your fist, not with full force, but maybe 50% effort. Hold for a couple of seconds, 1 to 3, and relax. And again, what this is doing, instead of working the muscles right at the back of the shoulder blade, we're activating the muscles just down here. So we're just trying to prevent any muscle loss whilst your wounds are healing. The third exercise is just getting a little bit of movement, but again, being mindful of the drain. So keeping yourself in a relaxed position, we're just going to try and take our elbows out as far as you feel comfortable, but into no discomfort and no pain, and drawing them back in. Out to the side, but not into any pain or discomfort, and back in. And again, you might be doing 5 to 10, not causing any pain. Even if you're just moving a centimetre, it doesn't particularly matter, but we're just trying to get a little bit of what we call shoulder abduction, which is your ability to take your elbows out to the side and back in. And then the final exercise, so the fourth exercise, is again just working on a little bit of gentle movement. So again, arms in a relaxed position, hands facing towards the ceiling. We're just going to gently try and tap our hands towards our belly, and then take our arms out as far as you feel comfortable, but not pain. Now, you may find one arm moves further than the other. Absolutely fine. Just again, not going to any pain or discomfort, and just taking it as far as you feel comfortable. So that's it for the exercises for individuals with a drain in place. All of them are around about 5 to 10 repetitions, 2 to 3 times a day, but again, you can do them more often, because what we don't want is things to seize up. So little and often, even if you did an exercise every hour, every couple of hours, we're just activating. They shouldn't cause you any pain, and really, we're just trying to keep things active. If you find being in a reclined position is uncomfortable, absolutely fine to do it sat up. For example, all of those exercises you can do in this position, but I would just encourage you to relax back. So be leaning against the back of a chair so that the muscles to the front aren't too active. So section 2, for individuals after the drain's been removed, and these we can start to push a little bit further. So we're going to start really, really simple, and we're just going to try and wake up and stretch out our chest. So starting with our arms nice and straight, drawing those shoulder blades, so similar to section 1, just pulling the shoulders back, and then you're just going to take the roof of your hand and slide it along the floor as far as you feel comfortable, and pulling it back down. And again, you may find one side goes further than the other, but we're just trying to take your shoulder into that abduction range, but not into pain. So it's a little bit more advanced than what we were doing with the drain. It's a little bit more active, and drawing it back down. Exercise number 2. So we're going to either have our hands touching our shoulders or behind our head. It depends on how uncomfortable your shoulder is. If your shoulder's uncomfortable, hands on your shoulders, raise your elbows, and you're just going to draw your shoulders as far back as you feel comfortable and back in. And you may find that you only get to there. That's not a problem. Draw it back in, but we're just trying to stretch out our chest. If this is okay, hand behind your head, same thing, elbows nice and high, squeeze back and back in. Again, we're just not going to pain, and trying to also be aware of what your muscles feel like to the back of the shoulder. Is one more active? Is one less sensitive? Can you not feel the side that you've had surgery? It sounds silly, but the more awareness you have, the more your body can then focus on trying to improve that sensation, because it knows there's an issue or a difference between the two sides. Exercise 3 is what we call shoulder flexion. So taking your arm up overhead. However, we can't do things actively at the moment because it is injured, and we don't want to cause any inflammation or pain or change the way the body's healing, because we've got very fresh scars being formed that we don't want to cause any injury. So what you want to do is support at the wrist, or actually have something to hold like a water bottle so it becomes passive. But I quite like holding at the wrist, keeping the elbow bent because it's going to put less strain on the whole tissue. And you're just passively, so the good arm that isn't injured is going to take all the weight. This one's floppy. And we're just going to go up as far as you feel comfortable and pull it back down again. So again, it's not contributing towards effort at all. And as you feel able, take it a bit further and back down. For this one, I probably would only do 3 to 5 because initially it might feel a bit uncomfortable or hard work. So just gentle, encouraging that movement, because what we want to do is loosen off everything under here that is injured. And then the final exercise, we want to add a little bit of activation of muscles again. So trying to wake those muscles up and get things working. So what I'd encourage you to do is, again, support at the wrist. And basically, your good arm is stopping your arm doing this movement. So we're going to keep our elbows into our sides. So we're not lifting everything up. We're just trying to rotate our hand away and basically push into the hand for 5, 4, 3, 2, 1, and relax. And again, not 100% effort, maybe 50 to 70% effort. Push into the hand. 5, 4, 3, 2, 1, and relax. And then finally, just a bonus 2 exercises for this stage. And we often focus on the shoulder as physical therapists, but that's not always the source of why people get problems, because it's not just the shoulder that gets stiff, our mid back and our neck can get stiff. So you can do this sat rather than led on your back, but basically all you're going to do is either keeping your hands on your legs if you feel it's uncomfortable, or gently crossing your arms. It's up to you. In this position, deep breath in. Exhale, keeping your sit bones where they are. Just turn your chest as far as you feel comfortable. And back in. Deep breath in. Exhale. Turn your chest. Or with your arms crossed, deep breath in. Exhale. Back to the middle. Deep breath in. And exhale. Back to the middle. Super simple, but it's going to stretch out the areas that support the shoulder so it doesn't feel too tight. And then the final exercise is just working a little bit on mid-back extension. So again, you can either keep your hands on your legs or crossing the arms. Again, deep breath in. And then exhale, looking up towards the ceiling. Again, lifting that chest, raising nice and tall, and back down. Deep breath in. Exhale, lift the chest and relax. Or with your arms crossed, deep breath in. Exhale, we're not bending at the lower back, just that mid back between the shoulder blades. Back in, last time. Exhale. And relax. There you have it, a couple of simple exercises that you can do for the first 3 weeks after surgery. They are safe and suitable for most people. I would again say little and often is key. They only take you a couple of minutes each time, but if you can do them several times a day, it's going to prevent anything getting really tight, inflamed and stiff, and that's going to try and help reduce your risk of developing any pain, stiffness, or other side effects. Give them a go. Let me know in the comments below how you get on, or if there's anything in particular you want me to talk about relating to cancer and physio. And keep an eye out for the subsequent videos where I'm going to do the slow progression so that we work on the mobility, the stability, and the strength, so that you can get yourself to a point where your shoulder feels maybe not exactly like it was before surgery, but into a really good position where you can do almost everything as you were doing before treatment. And then the last thing I'll say is I'll wish you the best of luck for not only your recovery from the surgery, but for any other potential treatments that you've got upcoming, because I fully understand it's a marathon, not a sprint when it comes to cancer treatment, and it is a challenging journey. So I wish you the best of luck.